Thank you for joining me today. Early and decisive actions, along with the hard work of Manitobans, have made a difference in our fight against COVID-19. And I want to thank Team Manitoba for all that they've done and for all you've shown through your strength and your empathy, through your courage, through your resilience. You stuck to the fundamentals, and I thank you for that, and for being calm and kind and giving to others, and for keeping safe through this unprecedented time. But there is no room for complacency. We do not want a COVID comeback, and our number one priority during this unprecedented global pandemic has been keeping you and your loved ones safe and ensuring a healthy Manitoba, not just today, but well into the future as well. Notre priorité numéro un au cours de cette pandémie mondiale sans précédent a été de vous protéger, vous et vos proches aussi, et d'assurer la santé du Manitoba aujourd'hui et pour l'avenir aussi. 3 weeks ago, our government unveiled Restoring Safe Services Together, Manitoba's pandemic economic recovery roadmap. It is a Manitoba plan. It was made by and for Manitobans so that we could move forward with confidence to slowly and carefully get back to business in Manitoba and reopen our communities and get back to the kind of quality of life that we've enjoyed here and that we will never again take for granted. Our plan has been evidence-based from the start. It lays out the groundwork to ease public health measures that had escalated since mid-January, and we have been able to create widespread public awareness. Manitobans continue to respond by, in all but a few cases, practicing the fundamentals and adopting physical distancing behaviors that are new, but that are necessary to protect ourselves and each other. The measures in place have successfully flattened the curve, so we're now seeing fewer instances of COVID-19, reduced rates of positive tests from the peaks that we had experienced in early April. A critical element of our flattening efforts and what has contributed to Manitoba's continued success has been our increased levels of testing, tracking. But I would point out that as we increase the numbers of tests and as we loosen these restrictions, it would be, I think, highly predictable that we'll see an increased number of instances of COVID, and I think we need to be prepared for that to happen. What we can't allow to happen is that we stop practicing the successful techniques and fundamentals that have been so effective thus far in keeping us all safer. As a result of our collective successful efforts in Phase 1, we were able to ease some restrictions, including elective surgeries and non-urgent health services, such as dentists, orthodontics, physiotherapists. We also were able to reduce some restrictions on outdoor recreation, such as playgrounds, golf courses, campgrounds, and on a number of retail businesses like clothing and sporting goods stores, restaurant patios, hair salons, all while ensuring that physical distancing measures continue to be in place. Key criteria have been met since the implementation of Phase 1 that allow us to now look at further easing public health measures. As Dr. Roussin announced yesterday, effective tomorrow, that's Friday, May 22nd, public gatherings will be increased to 25 people indoors and 50 people outdoors. Also, residents in personal care homes and long-term care facilities may have visitors outdoors. And I'm sure that's welcome news for many Manitobans. I've heard from some already in the last few hours who are very, very appreciative of that, and I know our seniors will also be very appreciative of those somewhat more loosened restrictions. Many Manitoba families have sacrificed a great deal in these last weeks, and they have sacrificed most certainly time with their loved ones, and that has been difficult for many. Today I'm really pleased to share with Manitobans our draft plan for Phase 2 of our Restoring Safe Services Together. I want to ask Manitobans for their input, as we have throughout this process. You can go to engagemb.ca to view this draft plan. I will also encourage all the business groups that have been part of this and trade associations and so on to know that tomorrow on our biweekly call they will have the opportunity, and this is literally dozens, close to 50 different groups who represent well over 100,000 workers in Manitoba, will have the opportunity to provide their input and their perspectives as well. We've taken this same approach when we did the Declaration of Essential Services, same approach prior to introducing Phase 1, and we'll continue to do it, and that is to ask Manitobans for their views on these issues. Clearly, all of us hope we can be in a position to move forward. Clearly, all of us hope that we can be in a position to ease some of the restrictions that have been in place for a long time. But I would emphasize again today that our ability to do that will be almost entirely up to Manitobans, and it'll be up to our medical experts to evaluate what they see over the coming few days before we are going to be able to take those steps. As part of Phase 2, I want to talk a little bit about schools. Our young Manitobans are probably, many would agree, our most precious assets, and we have to do everything we can to help support our students and protect them. Their educational needs are key to us, and preparing for a brighter future ahead is, of course, the focus. And we recognize that this has been a tough time for many of our students and their families. I want to say a special word to all the grads, including my nephew, and say, I know this is a tough time for all of you guys. We love you and we want you safe. That's the most important thing here, and I know that you're missing an opportunity to share in this experience, to give some closure to your K-12 studies and to be with friends in a way that you'd like to be. I know you're missing a great deal. Our hearts go out to you, but the first thing that you know that we have to bear in mind is how much we love you and care for you, and we want to keep you safe. It's been a tough time for students, but a tough time for everybody. The families involved as well, teachers too, and administrators. Everybody's juggling challenges, the challenges of remote learning, the challenges of missing classmates and coworkers and colleagues, the challenges that are very real for all of us in this system. And we want to make sure, as part of Phase 2, that we look at additional ways to assist our young people and those who help them in the education system in meeting their educational needs. So while in-classroom learning continues to be suspended for the remainder of the school year, we are currently examining the safe, limited reopening of educational facilities this spring to allow for additional tutorial days, such as one-on-one learning, assessments, and specific programming. To ensure students are equipped to transition to the new school year, additional teaching days are proposed for the upcoming school year, and I would emphasize to my friends at the Manitoba Teachers Society, obviously we're going to be in discussion with you about how we facilitate these changes. We want to do this in a cooperative way, as I know all educators want to, but we're, all of us, having as our first concern the best interests of our students. One of these changes, and you'll see it in the Phase 2 draft plan when you have a look again at engagemb.ca. Have a look at the draft plan and give us your thoughts on it. But one of the suggestions that we have is starting school this coming year on a one-time basis only on August 31st and repurposing some of those non-instructional days, or what some call PE days, throughout the school year so that we're able to accommodate some of the transitional challenges that our students are going to be facing as they resume their studies in the fall. The Department of Education is going to continue planning and consulting with school divisions and with other educational stakeholders. The draft plan for restoring services in Phase 2 builds on the measures we announced in late April, which set out an evidence-based plan to ease public health measures that have escalated since mid-January. Other measures are also being examined for Phase 2, and again, I invite you to have a look and give us your input. Expanding religious or other organizations' outdoor services, expanding child care center capacity and day camps. You'll see in the proposal on the child care centers in particular to go from 16 and move up to 24 young people. Reopening community centers, resuming organized activities and team sports, reopening indoor services at restaurants, reopening swimming pools, spas, fitness clubs, and gyms, expanding personal services. I'd emphasize on each of these categories and others outlined in the draft plan that there are strict protocols that will be expected to be followed for the restrictions to be reduced. And those protocols are much more detailed than you'll see in the draft plan, but they are there for every industry. They've been developed in consultation with each of the various industries. Whichever ones are affected by these know the protocols that need to be utilized. Just as for example, our golf courses, when we announced the reopening of golf courses. Many of those golf courses, all of those golf courses, are following strict protocols on development. Now, the draft plan will change some of those things and ease some of the restrictions, but there are still going to be protocols that have to be followed to make sure that we don't let COVID back in. No COVID come back in this province. And we can take pride in the progress we've made and the additional steps that we're considering today. But I will say again, we must remain vigilant. We'll continue here to review the data. We will rely on the advice of our healthcare experts to determine the next steps of our plans in the coming days. We'll continue to be successful here in Manitoba as long as Manitobans keep working together as a team. And I thank you for doing that, and I encourage all of you to continue to do that. Nous continuons à réussir si nous continuons à travailler ensemble en équipe. Remember, as we make this recovery happen, you are the reason that it is able to happen. You're the reason that we can hopefully move towards continued recovery here. That's what all of us want. But you know that if we have restrictions, and we continue to have some most certainly after phase 2, there are some restrictions that will most certainly remain, that it is your security and your protection that's the motivation behind those things. I know as spring's here and the weather becomes better that all of us are of a mind to getting outside, and we're increasing the likelihood of increased frequency of contact with one another. But the practices that we have used to get us where we are the practices we have to continue to use. And this is the new reality, and these are the new fundamentals. And we have to follow these fundamentals. Remember, not every Canadian is given the opportunity to save a life. But you do have that opportunity, and you have saved lives. And we'll save even more. Together, we're going to beat this thing. Thank you. Look forward to taking your questions.
Thank you, Mr. Premier. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this morning from CJOB, Diana.
Good morning, Mr. Premier. Diana from 680 CJOB. This is a massive list of services that we've been considered sort of as a draft, but obviously we have the date for the May 22nd with the increasing of gathering sizes. What kind of data are we looking at for the services that are being examined, things like gyms, things like swimming pools? When are those going to be allowed to reopen, just to clarify?
Yeah, at some point in the next few days, we'll, as we did with phase 1, we'll make an announcement in respect of phase 2. It'll depend on how the numbers look, and it'll depend, of course, on Dr. Roussen's advice. The medical experts have led the way in making sure they're evaluating all the data, and we'll act on their advice accordingly. But we also wanted to give Manitobans, as we had with phase 1 and other announcements, other decisions we've taken, want to give Manitobans the opportunity to have a look at the draft plans, give us their perspectives too.
And then just as a follow-up, again, this is a pretty large list of things that are going to be allowed to operate potentially. Will the province be hiring more people to enforce the public health order, given that so many new things will be opening up?
Well, we've actually expanded that list, and I understand that we're still improving the coordination and training, as this is a new a new expansion of over 300 new people. There are over 3,000 people empowered to ticket and to hopefully distribute educational information as well to prevent behaviors that would be dangerous to others. But we're continuing to endeavor to make sure that people follow the protocols and protect themselves and protect each other with that significant enhancement in the amount of security that we are now providing.
From the Winnipeg Sun, Josh.
Good morning, Mr. Premier. This is Josh Aldridge from the Winnipeg Sun. A lot of people are looking at the numbers over the last few weeks. The cases have been pretty low for a while now. I think there's only been one new case in the last week. They'll be asking why it's taking so long to lift some of these health orders. And could you talk about the balance between economic pressures and health and well-being of Manitobans, trying to find that balance?
Yeah, you've clearly identified the challenges. There are challenges in continuing the restrictions. There are challenges in loosening them. There are challenges with either course of action, and there'll be those who quarterback from the sides who say we've gone too fast, too slow, not enough too soon, and that's all fine. The reality of the matter is that we take the health considerations most seriously, that we followed the advice of health experts, and will continue to do that. I would say the other reality is there are, according to the health experts, factors at least as important or more important than the pure number of cases. But the number of cases, you're quite right, Joss, has been low. But in every other jurisdiction that I've studied or I'm familiar with, there's been something of a comeback. We want to make sure that that comeback is as limited as possible because we would like to see a sustained recovery here in the province of Manitoba, not the up and down that we've seen in many other jurisdictions.
Part of the draft talks about allowing travel to northern, direct travel to northern parts, campgrounds, cabins, lodges, and resorts while ensuring physical distancing. Are there going to be extra precautions taken in that, considering there's still a lot of communities that are concerned about the spread of COVID-19 up to those northern communities? There's a protest outside of the hydro plant project up there from the First Nations communities up there. How can you, address their concerns to ensure that they're still going to be safe up there?
Well, I don't think that those concerns about health and well-being of citizens are limited to northern communities in any way. I think those concerns are shared by every single community across the length and breadth of the province of Manitoba. The question of how we deal with these concerns is one that can be debated, but the fact remains, in respect of you're referencing a blockade, that we need to follow the rule of law and we need to make sure that we respect it. And this rule of law is based, in this instance, on practices that have been guided by and approved by our chief medical health officials. So, I understand and I applaud. In particular, I want to applaud the work of our First Nations leaders in keeping COVID out of their communities. At the same time, we have to respect the rule of law, and we have to make sure that people's rights to movement are respected as they are provided under our Charter of Rights and Freedoms.
From CBC Radio Canada, Patrick.
Bonjour, Monsieur Pallister. Patrick Foucault, Radio-Canada. Today's announcement shows that statistics are encouraging. So with that in mind, do we have a more specific idea of when we could see phase 3? I know we're only thinking about phase 2 now, but do we have a better idea of when we could see that third phase also?
Well, I won't speculate on that, except to say I know Manitobans share the hope that we can keep the COVID curve flat so that we are able to move into phase 2. And only after we move into phase 2, quite logically, would we be able to consider phase 3.
And if we're thinking about places like spas, places like restaurants, so what is the difference between reopening places like this, but not necessarily allowing, our regular return to in-person classes for students in schools?
Well, I think that there are clearly some possibilities under the draft plan, stage 2 plan, for us to have limited, careful, thoughtful reopening of some schools to allow for in-person coaching, counseling, for in-person instruction as well. That is the limit to which we're going. Look, I'm not going to roll the dice with the children of Manitoba here. I think that the reality is that we're in an unprecedented time. The congregation of a large number of people in a small space, which a school requires, is potentially a transmission danger, as the health experts have said, not just to students, but to staff, I should mention as well, to instructors, to cleaning staff, maintenance staff, and so on. So, look, we are approaching June. We have a few days left of instruction. The teachers have responded, I think, incredibly well. I thank them for that, and I say, you know, if we can modify under this plan our ability to actually help some of the kids who may need additional supports now and in a little earlier in the fall, I think it's a pretty good plan. But you know, I'm looking for perspectives from Manitoba parents, educators, students as well, on how they think we should proceed.
From CBC Manitoba, Ian.
Good morning, Premier. Ian Frey, CBC. You did just note that it would take a few days to determine when to reopen. The initial roadmap said it would happen no earlier than June 1st. Is there flexibility? Could we see part of phase 2 before June 1st?
I suppose we could speculate. I try not to answer hypothetical questions too much, Ian, because that tends to get me in trouble. I'll just say this. We'll benefit over the next few days. We'll benefit from the perspectives of Manitobans and from the groups that are very much affected throughout our province who provide services to Manitobans. We'll gain from their perspectives. We'll also gain from the perspectives that we'll get on data. I've always said I expect there'd be more cases coming up. It's just a question of how many more, and if we can keep that relatively flat, then that's really the goal. A few more days to get some perspectives, as we did with stage 1, I think is useful. A few more days of data, because remember, it's only been a couple of weeks since we introduced the phase 1 changes. And so the impacts of that are going to be seen over the next few days, potentially with possibly with more cases. This is what the doctor's advice will hinge on, in part, not just number of cases, because there's going to be more, I expect, because there's more testing being done, right, and more interactions, and that adds to it. But I would say having a few days to make sure that we do our best to get it right makes good sense. There'll be those who say, "Why didn't that wanted these changes to be happen weeks ago?" I understand that. I do. I understand the frustration, and I understand it especially as a former small business person. People have their lives at risk. They have money at risk. They are working very, very hard to try to get back and going again. But we want to act cautiously, and out of an abundance of caution, we want to make sure that when we introduce phase 2, we don't then have to unintroduce phase 2 later on.
And one of the criticisms in phase 1 was that, some personal services, say hair salons, were able to open before nail salons. It now looks like phase 2, the plan is really to open it up to all of those personal services. Why make that change and sort of open it up to them all?
Well, you could raise questions, I suppose, to be fair, Ian, about every category. Every category of services has some impact when virtually every one. Not those, obviously, in phase 3, where there are some broadenings of the rule changes and restrictions are loosened that impact on those. We're acting on the medical advice we're getting. We believe that with these changes, we can continue to keep the curve flat. I think that's what everybody wants, and that's the goal we're all after. But again, I'll say it. It hinges on Manitobans' willingness and ability to adhere to the same fundamentals that got us the progress we have had to date.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Premier, do you have a number in mind, or has Dr. Lucen shared with you some sort of data set that might prompt a reversal if we see the numbers spike to X amount, or a cluster of X size, would that prompt a shrink back of the relaxed rules?
Yeah, Dr. Roussin, he's the scientist. I am very interested in learning from him, and I think all Manitobans have benefited from his work, and I thank him again for that. He has referenced several statistical ratios or percentages that he considers important in this. I think it best, though, that he share those with you in an hour and a half. But I would say they go beyond just pure case numbers. That's the easy one. The more cases, the less secure we all feel. But there are other factors that he considers as well.
Okay, and pro sports, large crowd gatherings, concerts, that sort of thing is a long way off. The CFL has been in discussion with the federal government for financial aid. Is the provincial government considering giving any financial aid to the Blue Bombers, and has that been discussed so far?
We've had ongoing discussions with the Blue Bombers. As far as additional financial aid, no. As far as existing financial aid, continuing with some of the previous supports, those have been under discussion. Obviously, we love our Bombers, and we've never been more proud of them than we were last fall. But we're going to continue to do our best to support them, but safely, and everyone understands that in the Bombers organization.
From CTV Winnipeg, Stephanie.
Good morning, Stephanie here from CTV. This morning, or I was either this morning or yesterday, the Canadian Medical Association has said that provinces are gambling by reopening. Obviously, we're kind of in a unique situation compared to, say, Ontario and Quebec. Just wondering what your thoughts are on just that phrasing, gambling on reopening. Do you think that's the case?
Well, I don't know the specific Canadian Medical Association reference that you're making, Stephanie. So I'm pretty sure, though, if they said that, they weren't talking about Manitoba, because we've been following the advice of medical experts, and a pretty renowned and respected medical expert in our actions here. And so I don't think it would be fair to describe the advice that Dr. Roussin would give us as being gambling in any way, shape, or form. I think that would be an inappropriate reference. They may be talking about some other provinces and the steps they've taken there. I can't tell you because I haven't read the quote.
Mm-hmm. And you mentioned, we are likely to see a few more cases just with the restrictions being eased. People are out more, the weather's nicer. Are we prepared? Are hospitals prepared if we do see an influx? Yes,
and I'm very, very appreciative of the incredible work of our team, led by our Health Minister, Cam Friesen, but by the people, senior people in health, administrators across the province. I want to thank our nurses, our medical professionals, everyone involved, everyone that keeps those facilities running. We have additional capacity if we need it. We are more secure in our PPE, our protective gear, than we have been for weeks and weeks. We have additional ability to help people in transition, homeless, for example, people. We have upgraded our availability. I thank the nurses who've come back from retirement to come back and bolster our ranks there. And I want to also say a special thank you to the people in the Department of Families and in the people in the childcare industry for stepping up and making childcare available to our frontline workers. All these steps and many others, dozens of others, have put us in a position where we can be quite confident that we could handle a significant outbreak of COVID-19 if it were to occur here. Of course, we've been blessed to not have it happen, but it's the Boy Scout motto to be prepared, and I don't claim to be a Boy Scout, but I think we've all heard the motto, we are prepared.
From City News, Stephanie.
Vice Premier Stephanie speaks from City News. Is it safe to say that if Manitoba keeps its testing numbers up and COVID-19 cases down at the levels that we've been seeing, that this plan will go into effect on June 1st?
It's safe to say that our testing numbers have accelerated. I think there are a number of reasons for that. We've opened, as you know, additional testing sites. We've also had a scare recently with an employee at one of the big box stores. I'll leave the name out. When that happens, Naturally, the public is frightened by that, and then members of the public who fear they may have come into contact with an affected person pursue testing. That pushes the number up. As that number of people seeking testing gets pushed up, the likelihood of increased number of cases goes up too. So I have always said that I expect that number to rise, and I don't think that it would be wise to miss the opportunity to share this plan with Manitobans and with the special groups that are affected in particular, like small business groups, over the next few days while we monitor the situation as it evolves as a consequence of increased testing, increased social interaction. With the better weather, we've seen that. That's one of the factors, obviously. And just frankly, to have more data in our hands so we're able to make sure that we're doing the right things based on the best up-to-date information that we can get.
Okay, and will there be public health officials working with some of these league managers or the new businesses that will be opening, kind of site managers, to just make sure that they're aware of all these guidelines and that they're all being followed prior to opening?
Yeah, we've done an incredible amount of work here. I want to thank the MLAs. Government MLAs have been involved in working with the associations every step of the way and helping them to coordinate the development of protocols, practices, procedures that will protect customers and clients and staff. And that work has been ongoing. It's a tremendous amount of work. And so I thank the MLAs that have been involved in that work. And I thank the people from the various retail and trade associations, too, who've obviously been partnering with us in that work. These groups have been more than cooperative. They're just absolutely supportive of our efforts. They understand the need for additional safety for their clients and staff. And the protocols that we have developed, I am told, exceed the work done in virtually any other jurisdiction across the country. This work is important because it is in following these protocols that we make sure that we're protecting our recovery, and the people of Manitoba and their safety is what matters most to all of us.
From the Winnipeg Free Press, Carol.
Good morning, Premier. It's Carol Sanders at the Free Press. The Prime Minister is wearing a mask. The U.S. President is not. Dr. Rusin said it's one more layer of protection, but it's not the most important way of protecting people around you or yourself. I'm just wondering, what are your personal feelings about wearing a mask?
My personal feelings are that I'll follow the advice of Dr. Rusin.
Okay. And with outdoor gatherings of up to 50 people being allowed in grad season here, I know you said your nephew's graduating. There's probably going to be plans for parties. What's the plan for dialing back the reopening if there's a major outbreak, like a super spreader event? Will there be a reversal of the reopening or a targeted approach to where and how the outbreak began?
Yeah, we'll cross that bridge when we come to it. I just hope we don't come to it, Carol. I think all of us want to make sure this recovery is one that's sustained, and that's why all this preparatory work, why the consultation is happening, why the protocols and the intensive work that we've done on that front have been undertaken. It's just we really don't want a COVID comeback. We know that it's happened elsewhere. We know that it's dangerous when it happens, that it impacts on lives directly, and it impacts on economies as well. And so clearly that's what we're working very, very hard to avoid.
From Global, Brittany.
Good morning, Mr. Premier. Brittany from Global News. When we had to do the lockdown, cancel school, teachers went to online learning to help their students. Now they're being asked to start up early, give up some of their Pro-D days. I'm wondering if you've had any discussions with the teachers union or with anybody on what that might look like and how teachers are feeling about this new plan.
My education minister, Kelvin Gertson, has been doing a tremendous job on this front. I know that he's had dialogue. I expect he'll have much more, not just with my whole union, the MTS. And I want to say thank you, a special personal thank you, if I could today, to James Bedford for his personal condolence note to me. Touched me. I thank you, James. It was wonderful. Thanks for doing that. It was well appreciated. On the issues around schools, I can tell you that what we're proposing in the plan in the interim steps of the next few weeks I think will be well received by teachers. I've had some preliminary input from teachers who have been working so hard and have been so adaptable through this process to adapt their teaching strategies to the technologies they've had to, many of which they're familiar with before, but not in this context. And so for teachers, I think this has been a challenging time and you know, in an interesting way, kind of a rewarding time. But at the same time, over the next few weeks, they'll have the chance, because they know that some of their students may not have taken to the new adaptation with as much success as others. They'll be able to devote some of their time to the remedial challenges of assisting those students who particularly would benefit from some one-on-one counseling, some one-on-one tutoring, or small group settings, depending on what we arrive at with the school divisions and the various administrators and school educational leaders. So this is an opportunity, I think, with the tentative plan to move in a way to help our young people transition effectively that would be absent if we don't reopen schools to a small, limited degree. And that's what's being proposed in phase 2.
I know we've been dealing a lot with the unions over the past few weeks and months, a lot of that maybe not having gone favorably. Do you anticipate pushback from the teachers' union on this when, again, you even said so yourself, teachers have had to quickly adapt to what's been thrown at them over the past few weeks and now being asked to give up some of their summers as well?
Well, that's just not a shot at you, Brittany, let's be clear, or at the media. I'm just going to simply say, I haven't heard anything about the 95% of cases where the relationships with the unions have worked favorably and have been mutually supportive. I've only heard about the 5%. That would be up to the media to reflect upon. That being said, on the issues around MTS, I think that there's no doubt, and there's never been any doubt in my mind about that union having its key focus being the best interests of students in our province, and that's exactly where this government's interests lie. So I wouldn't anticipate disagreeable exchanges with the MTS. I just anticipate they might not be reported if they're agreeable.
From the Brandon Sun, Colin.
Hi, Mr. Premier. Colin Clark from the Brandon Sun here. With the number of people being allowed to gather outside increasing, is there any chance that high schools will be allowed to hold some form of modified graduation ceremonies this June?
I would say it's extremely unlikely, and I would say that Dr. Roussin could be asked that question later and you'd get a more detailed explanation as to why that would be the case.
No follow-up question today.
Okay. Just want to say thanks to everyone. Appreciate your ongoing coverage, despite that little jab I had in there before, which I think was entirely justified. But I do want to say to Manitobans, please continue to do what you've been doing to get us the progress we've enjoyed to date. Review the plan, give us your feedback, and keep doing the great work of being patient with one another, supportive of one another, keeping social distancing in your minds as you move around increasingly outside. And make sure that you don't go to work if you're sick. Do the right things. We'll get through this thing. We'll beat this thing together.